Chapter 9 Drug acting on autonomic ganglia. Drug acting on autonomic ganglia. Drug acting on autonomic ganglia. Ganglionic transmission. Ganglionic transmission. Acetylcholine ACH is the primary excitatory neurotransmitter in both sympathetic and parasympathetic ganglia. Drug altered the ganglionic function by either stimulating ganglionic stimulant or blocking ganglionic blockers the impulse transmission through the autonomic ganglia. The principal pathway of impulse transmission through the ganglia involves release of ACH from the preganglionic nerve ending and the stimulation of nicotinic receptor by acetylcholine on the post-junctional membrane (EPSP), causing rapid depolarization and subsequent propagation of the impulse through the postganglionic nerve fiber. ACH muscarinic nicotinic alpha-adrenergic blocked by atropine, nicotinic blocked by hexamethionine, blocked by dibernamine. Acid as discharged from the preganglionic nerve terminal and interact with a nicotinic receptor on the ganglionic neuron to cause a rapid depolarization measured electrically as a fast excitatory postsynaptic potential (EPSP). ACH also interact with a muscarinic receptor on the ganglionic neuron to cause a delayed depolarization measured electrically as a show (EPSP). In addition, ACH activates nearby chromaffin cells through a muscarinic receptor which results in a release of catecholamine, dopamine or epinephrine. CA interact with an alpha receptor on the ganglionic neuron to cause an inhibitory hyperpolarization response measured electrically as an inhibitory postsynaptic potential (IPSP). Ganglionic stimulant. The ganglionic stimulant stimulates the nicotinic receptor like ACH and cause EPSP and rapid depolarization. Natural alkaloids nicotine. Natural alkaloid nicotine. It is obtained from the leaf of Nicotiana tabacum. Small dosage of nicotine stimulates the CNS. Large dosage cause tremor or even convulsion. Respiratory stimulation is due to direct stimulation of medullary respiratory center and through activation of carotid and aortic chemoreceptors. The stimulation is followed by depression of the CNS. Nicotine can stimulate the sympathetic and parasympathetic ganglia in small dose. In large dose, it blocks ganglia. The effect of nicotine on GI tract are due to stimulation of parasympathetic ganglia, which include salivation, increase in tone and motility of GI tract, and defecation. Nicotine toxicity may cause CNS excitation, followed by marked depression and even death due to central respiratory failure and paralysis of peripheral respiratory muscles. NB nicotine transdermal has been therapeutically used for treatment of nicotine dependence and as an aid to smoking cessation. Lobeline. It is obtained from the leaf of Lobelia inflata. Synthetic compound trimethylaminium TMA, tetraethylammonium TEA, dimethyl phenylpyrazinium DMPP. Ganglionic blockers. This drug competitively agonize the action of ACH on the nicotinic receptor on the postganglionic membrane and thus block ganglionic transmission. Ganglionic blockers are all synthetic compounds: hexamethonium, pantolinium, trimethophan, mecamyline. Pharmacological effect of ganglionic blockers: CVS, vasodilation, increased peripheral blood flow, venous pooling, decreased cardiac output, hypotension, and tachycardia, GI tract, reduced tone and motility, eye, mydriasis and cycloplegia, bladder, relaxation and urine retention, sweat gland anhidrosis, salivary gland, xerostomia, dry mouth. Thank you.